All right. All right, so I'll call the meeting to order. Molly's already taken the roll. Senators will be excused until they arrive. Minutes are approved unless there are objections, seeing none. And again, just so you know, we're live streaming today's meeting. That's been pretty successful. We've gotten a lot of feedback from people, and it's very helpful to the disabled who can't make it here for the meetings. DHS staff will have a presentation. Well, you don't have a presentation, but you'll be answering questions. And we don't have representatives from the Attorney General's office today. But again, Medicaid Privatization Implementation Report, Q&A. Mickey Steer, our Medicaid Director. Jean Slaybaugh from DHS, she's a CFO. Liz Mathis, the Medicaid Managed Care Bureau Chief, is here. And then MCO representatives, Kim Foltz from the Health Plan Chief Executive Officer from United Healthcare.
Down there.
Cheryl Harding, the Market President from Iowa, AmeriHealth Caritas. And Cynthia McDonald, the Plan President from AmeriGroup. And that's what we have here. So thank you for coming. Let's start with, does anybody have opening remarks? Anything you'd like to update, Mickey, for us, please?
Again, we want to say thank you to you, Senator Mathis, and to this committee for inviting us again to give you an update of where we are with the implementation of managed care. In addition, we also appreciate lawmakers' dedication to oversight and ensuring members get the care that they need. It's important. We continue to see no major systemic issues with the implementation of managed care. For an implementation of this magnitude, we've been able to handle the volume of questions and concerns to quickly address members' and providers' needs. The MCOs are experiencing a similar with sharing of information and troubleshooting. We're working in coordination with each other to ensure that we can address these quickly. We're always focused on members getting their care. Our rapid response is from 10 minutes to 24 hours for the individual members that we're dealing with. And providers, we're working collaboratively to deliver care and ensure that what they need in order so that they can get paid. And providers' issues are also addressed within a minute to 1 business day, depending on the complexity of what the provider has. In addition to that, we have been offering training available as well as system testing. And we hope providers are taking advantage of these tools before billing really gets underway next month. We've started to see some billing, and we'll give you some statistics later on this afternoon. The trainings have been happening across the state as well as with the MCOs, and the MCOs can speak to the training. They're really encouraging the providers to work with that and also work with their, their webinars and their testing. It's very important to do that. We've also received public feedback, as you are aware. DHS public meeting last week in Burlington. We have an upcoming virtual roundtable for our providers, which will be next Tuesday on the 26th. We've attended the Senate Democrat community meetings in the past 2 weeks, and we appreciated the feedback. Looking forward to listening and learning and assisting. And we've also done over 350 public and stakeholder meetings as well. So those are some of the basic updates that we have, and as we go through this, I'm sure you'll be asking us additional statistical questions, and we'll be happy to answer those as well. So thank you again.
Thank you. I also want to thank you for, I emailed all of you and asked you to participate in something maybe in Marion, and something that we would try to do in terms of just moving some helpful hints along. So I've asked you to bring representatives. We haven't selected a date yet, but representatives who can sit down, bring their laptops, look up some case work, case management, try to make sure that people are getting to the right providers, et cetera. So we'll put out something in the next weeks or so. It'll probably be after session, obviously, for you all to come to Marion to bring representatives so we can get some questions answered. And it's a face-to-face opportunity, I think, for at least the people in Cedar Rapids, Marion area. So thank you for doing that. I guess I'll just lead off with, let's talk about billing. So describe to us what this is going to look like on the provider side when some people are starting to bill every day, some are weekly, some are at the end of the month. What kind of tools do they have on their side? Is it adequate enough that they're going to be able to bill properly, and what are your expectations for billing? What are the things that they need to do properly to make sure that they get paid? It's a loaded question, big question, but I mean, everybody's asking it. In fact, I think somebody at Senator Dotzler's forum last week, somebody from Lutheran Services said, it's 2 weeks into the transition, they've just started training sessions on billing. She said, I get it, it's innovation, creativity, that's great, save some dollars, but let's do it in a sensible manner. They've had months and months, almost a year to prepare for this day, but we're still not ready. She was referring to billing. So describe to us what's going on.
What I'd like to do, if you will, ma'am, is I'd like to defer to each of the MCOs. I think that they can talk about their billing and what is expected of the providers and how it best meets their needs. They also do, to your point, they do bill in different increments, and I think they can explain that as well, if you're okay with that.
Yes.
Thank you.
I'll start us out because I'm sitting in the first seat, I guess.
Please introduce yourselves
I'm
as you
sorry.
go along for people like
Surely. Cynthia McDonald, I'm the plan president for AmeriGroup Iowa. So in terms of billing, and I would guess as MCOs, we are similar in that. So actually, we have done months of training, outreach, both direct outreach, webinars. We will do individualized training. We will go through step by step on filling out a form, filling out a box. We will do it through a webinar. We will do it in person if needed. We will do it in groups or in individual sessions. So what the message I will convey is we will do it in whatever forum is needed to be able to meet the needs of that. It's very important. We're heading into the critical zone, as Director Steer said, and ensuring that that providers know how to work with us. It's very important. It's a very important value to us to make sure that you are able to work with us. And we have claims. In fact, I'll give you a little stat. We've received 33,000 claims to date. Our average turnaround time, it's called the TAT score, is 4.8 days. Any claim that is denied, we do, for any claim that is denied, and I mean any claim that is denied, we will work that claim through. We will hold it. We will examine it. We will determine the reason for it. If there's a legitimate reason for denial, we will work forward. If it's an area that we think would be helpful to work with the provider, we will even reach out to the provider and talk with them about that denial. So we are very intense about it, in a very intensive process to ensure it goes well. And then we have an even greater sensitivity, I guess I could say, to community providers, to ensure those providers that are, having to watch their bottom lines very carefully, and ensuring processes around that. Again, outreach processes, very individualized, connected processes, if that is warranted, if that's what they prefer us to do. So
Tell me what it looks like on their side, though. Did they have to get special software to do this? Was it at their cost? And then the time for training, was it at their cost? And what did it look like for Cynthia, like on your end?
Sorry, we're conferring.
yeah, make sure I'm not misspeaking.
Yeah, do you want me to?
Yeah.
So generally, the answer to that is no, they didn't need to get the additional software. The one exception to that I'm aware of is that there were some providers who were billing only Medicaid historically that had a single user version of a particular software that submitted bills to IME, that because of the need to bill multiple payers may have had to do an upgrade to a multi-user version. So it was we don't know the exact number of those, but it was under, I think at the high end it was a couple hundred. I actually think it was under 100 provider offices. It was smaller agencies that had just that single user. So there was a small group of providers that had to make a change in order to bill multiple
And at their
payers.
cost? At their cost?
Yes.
Okay. And how much would that have been?
Well, can I clarify that answer?
Sure, yeah.
That was probably too quick of an answer. At their cost, if they wanted to keep using a software like that, we each all have, I believe this is a true statement, I always hate to speak for others, but we each have an online version where instead of entering it into that software they were using, they can enter the claims directly into our systems, which did not have a cost associated with it. So it depended on the choice they wanted to make in that situation. And I'm sorry, I do not know the upgrade cost. I heard it was fairly minimal, but I don't know what the cost was if they chose that path.
3,000 claims at AmeriGroup. How many for AmeriHealth and how many for United Health have you seen claims processing?
So we have about 25,000 right now. About 25,000 have come in.
Kim Foltz with United Healthcare, and we have approximately a little over 28,000 claims so far.
Flowing. Okay. Any other thing that you'd like to say about billing? Anything you'd like to offer for providers that would make things go smoother?
I think we're all doing the same types of things. I think the thing I would say to encourage people is to please call us if you're having concerns so that we can help walk people through it, or we can get our vendors to help walk people through it if there is any complications through the process.
And I would just say there's a large percentage of providers that are utilizing standardized claim forms that have not changed. So we all recognize and accept those standardized claims forms. And I would echo what my colleagues have shared, that our interest is to ensure that providers understand every detail. And we will work with them, whether that is in person, whether it is via a webinar, whatever meets their schedule, to ensure that they understand how to interact with us, how to bill, and any questions that they may have, we want to make sure they get answers.
Other senators? Other senators have questions? Oh, certainly you do. Senator Jochum, would you like to ask a question? An hour. We have 45 minutes.
Thank you, Madam Chair. Director Steer, I want to start with you. I read an op-ed that you had that was posted in the Sioux City Journal, and written by you, and you mentioned here that some providers have chosen not to participate in the new program. So my question is, what percent of the fee-for-service providers have not yet signed with the privatization of Medicaid? I've seen that the Des Moines Register ran a story, and I believe they thought about 70% of the fee-for-service providers were now on the network. But I don't know if that's true or not. I'm assuming it is, that they would have accurate information. But you do mention in your op-ed that some providers have not chosen to participate in the new program. So how many?
It's approximately 4% of the fee-for-service providers.
So that's quite a bit of difference between what you're saying and what the Des Moines Register had reported, I believe, over the weekend, where they said about 70% have actually enrolled. So
There's 96% that have actually enrolled. There's 4% of the fee-for-service providers that have chosen not to participate.
And could you give us the type of provider and where their locations are? If you don't have that today, would you please send it?
Yes, ma'am, I will.
Thank you. Okay, so I have gotten several questions from other providers, so I'm sure that the managed care organizations would be glad to hear some of this and maybe can figure out how to straighten some of it up. The first one has to do with the cap on therapy. Apparently, there's a $1,920 annual cap on therapy. But what I am getting is questions from rehabilitation organizations, which is not the same thing. And I believe that on page 50 of the benefits manual, it says there is no cap on rehabilitation. And yet, when these rehabs have sent in their bills, they are being denied payment, saying that they needed the prior authorization and that there's a cap and it's 12 visits a year. And so there's a lot of confusion on whether or not rehabilitation therapy actually is, if that 1920 cap is being applied to them, or if it's just therapy, because there's a difference. So if all three MCOs would like to respond.
For AmeriGroup, we do not have a cap on rehab, rehab therapy, so I'm not totally clear what that stat is about.
Apparently, when they're calling, whoever is at your call centers is telling them something different. So perhaps you need to do some more work with the people at your call centers
take a
then.
look.
United?
So rehab agencies do not have a cap, and again, it is specific to a rehab agency. Individual therapists There are caps, and that is following the state guidelines that were consistent prior to implementation. So there are distinct differences between a rehab agency and an individual therapist. And so we'd want to make sure that we understood the details so we could speak specifically to the individual provider and make sure we were answering their questions. If someone called in and they weren't specific about who they were, where they were, what they represented, there could be confusion, so we'd highly encourage providers to be very
Well, they
specific.
did. They corrected and said, no, we are not therapy, we are a rehabilitation agency, and they still said, no, you're under a cap.
So there is no cap, and I can
Right,
confirm that.
so I'm
for
saying is that
United
you need to
Healthcare.
clarify that with your call centers, because that's not what the rehabilitation agencies are being told by any of you right now.
Well, we appreciate
Okay.
that feedback, and we'll ensure.
Good?
that we get that.
Okay, so here's another question, and this is on when the beneficiary has private insurance as well as Medicaid. My daughter's one of them, she's on my plan, and then Medicaid's her secondary insurance. But what is happening is that at IME trainings, the providers are being told that they do not need a pre-authorization when the MCO is secondary. But in discussions with AmeriGroup, we're told that if AmeriGroup is secondary and the primary insurance has a deductible, that they have to then get pre-authorization for AmeriGroup, even though they're the secondary insurance. Want to respond to that?
I guess I'd have to take a look at that and understand the issue maybe a little bit more. I understand secondary payer, I understand that's the issue, but I would have to maybe follow up with you on that
Okay.
specifically, just to ensure I'm answering it
I
correctly.
think they're trying to figure out what's accurate, because they're being told two different things.
Sure, yeah.
On
I
one
hear
hand,
there's
they're
some
being told,
confusion.
no, you don't.
Yeah.
And then on the next hand, they're being told, yes, you do. So a lot of confusion
Okay.
on those who have two different insurances, where the primary is private and Medicaid is the secondary insurance.
Surely, so I can,
And I'm hearing that from about all three of you, by the way. It's just not one, it's all three. I'm going to stop there. I have many more, but I'm sure there are other senators have questions, and I'll go back through all my notes because I have pages here. And these are from all different providers from all different parts of the state.
I have Senator Johnson, Senator Ragan, and then Senator Petersen. And Dotzler.
Thank you, Madam Chair. I want to cover about three different areas. First, well, you know, we're having delays in pre-auths here. Well, let me start with this. You know, I talked a while ago about having better communication here. And I'm going to just ask members of the committee, have you had a personal visit from the governor's staff, other than getting these press releases talking about all the success stories like the 5 that we got today? I mean, have we had any contact? I don't know if somebody's here from the governor's office, but I would be happy to sit down with somebody and then think that the governor's office ought to reach out, or somebody from the administration, and we ought to, you know, I don't know, I have no way of verifying these things. You know, I think a lot of the emails that we've shared as committee members have come with names and addresses, whether they be healthcare professionals, or they be the actual patients or family member caretaker type. Okay, so just here's a couple of items that did not make the governor's press release today. This is from a hospital administrator. We had an inpatient stay tonight. We requested a doctor-to-doctor call with the MCO. Their physician did not call back. We made a follow-up call. We have yet to receive a call back. In the process of seeking assistance on this matter, our staff member spoke with 7 different MCO representatives. Okay, next case. One MCO told us starting May 1st, they would no longer honor the practice of a home health aide visit to provide basic care support services unless accompanied by a registered nurse. This has been a service traditionally provided by home health aides supported by periodic supervision visits by an RN. It would not be efficient to regularly send 2 staff members to perform these basic services. If these, and here's a comment from the hospital CEO, if these inefficient administrative practices continue, it's likely that clinics and hospitals will have to add staff members to keep up with these overly burdensome MCO processes. I would like each of the MCO representatives to comment, please. Who out there is, and I don't know, and I haven't had time today to follow up, but who out there is requiring an RN to go on a home health aide visit, and why?
I do not believe that's our request. It's not our process, as I understand
Well,
it.
okay,
If that is our member, I would certainly
That's
want to
not
hear
a
about that.
sufficient answer.
Yeah,
That's not a sufficient answer.
We're
Is
not
I don't
requiring
believe, okay, if we can't answer the question with certainty, I would like to get a response from each of the MCOs, okay?
Absolutely, yeah.
Okay, so let's just, I know there's a lot of questions here, but there's number one. So we have that. So I covered the press release, and I've covered a couple of situations there. Kim, I want to talk to you about United Health Group Incorporated. I want to know what the impact is going to be about them dropping a number of state exchanges. I just noticed that in today's Wall Street Journal and it's a large company. It's the largest insurance company in the United States. This is a small part of their business, but still I'm concerned about what the effect is going to be on our transitioning to managed care. The company's shares went up 2% yesterday. They're up nearly another % today. It's a buy, according to one stock analyst. Let me see if I can call her up again. She called the company's decision to dump these state exchanges the right and inevitable decision. What is UNH, that's United Health? What is UNH supposed to do? Sacrifice itself on the altar of a flawed national health policy? So now folks understand, UNH will do what it must do to protect its stakeholders, and it always pays to listen closely when United speaks and follow those comments to their logical conclusion. Now, I'm not a stock analyst. I know that there's probably some code language there for something about what my investments ought to be, but it's up 3.5 points in 2 days, nearly 3%. Kim, I would like to know what the effect of this might be on the MCOs or on your MCO dealing with managed care. And am I wrong, and I've said it a number of times publicly, that without legislative oversight and some legislative oversight with some teeth in it, that the stakeholders, I think, that are being referred to are the shareholders, unless I'm reading that wrong. And am I wrong then to say, without legislative oversight, the oversight is being provided by the stakeholders? This is a heavily traded stock. Okay, that's my question, Kim. I'd like to expand on that if you can.
Well, I'm not a stock analyst either, so I'm going to say that I'm not going to speculate related to the information. It is public, and so you have access to every bit of information that I have access to. My focus and emphasis and our commitment to the state of Iowa is for Iowa's Medicaid program, and we remain and will be steadfast in our commitment to serve Iowans through the Iowa Medicaid program. The exchange product is a separate product and a separate division. I do not have any leadership oversight for that division, and so I cannot speculate here today. But I would say again that our commitment is to Iowans, and we have demonstrated that commitment as evidence to our 30 years plus 3 decades here in the state, delivering products and services and serving over 700,000 Iowans today. We are committed to a sustainable program, and we are committed to Iowans, and that's why I'm here today.
Thank you, Madam Chair. I would just say that just for the committee members who might not be tracking what's happening in the insurance industry, you know, Aetna is waiting for federal approval to take over Humana and Anthem to acquire Cigna Corp. So, I mean, these mergers are going on. They're waiting for federal approval. Again, we are dealing with people here, patients, clients, and the people who are in our, I'm hearing that over and over again. This is moving ahead with the assumption that the staffs of our clinics have all this time to sort out people's problems. It's a bad assumption. They're being pressed by the Affordable Care Act regulations already and insurance regulations and everything else. So just keep that in mind, please. I'm sure you are, but I'm just going to reiterate that again and keep that in mind. Thank you, Madam Chair.
Thank you, Senator Johnson. Senator Ragan.
Director Steer, this is really a question for you. In North Iowa, we have one of the MCOs that hasn't signed the contracts yet with a lot of the providers. So we have beneficiaries that are going in for services or having services canceled. So how does that get handled? They won't get services for the month if they switch to another provider at the 100%, correct? It would have to be at the 90-10.
So you're asking me if a provider isn't providing services in your area,
Right.
and that member walks into a physician or a provider's office and they need services, if the provider chooses to see that individual, you are correct.
It's a 90-10.
Yes, ma'am.
So the other question that goes with that is, and I believe I saw an IL that came out that said providers are not able to help beneficiaries choose which managed care organization that they should go to. Is that correct? Or can they help them select that?
They can
The
provide,
providers can help
They can-
select or not?
they can give education, but they cannot, there's a federal regulation that they can't do steerage or they can't influence them. They can give them information about all three of the MCOs, and they can give them the value-added benefits that they have and educate them on what services they have, but they can't say, you know, we would prefer you to go X or Y. They can't do any of that kind of
So
movement.
that person really is on their own after they go into that office unless they find someone else to,
The
they
other-
can't really direct them and say, you know, we're not taking that provider, so take one of the other ones.
They can't direct them, but what they can do is they can also ask them to call member services, and we have conflict-free member services that can help that member walk through and give them higher education and better choice.
Okay, so, but I just wanted to clarify that the provider's not able to help them make that selection. Okay.
Yeah.
Senator Petersen.
Thanks. My questions are for Director Steer. The legislature has had significant concerns about making sure we have appropriate oversight established. And one mechanism for oversight for Hawkeye is the Hawkeye Board. And at the last Hawkeye meeting, the chair, whose term ends on April 30th, brought forth that 2 of the slots for citizens on the board would be vacant. Can you explain why the governor has left a citizen slot open on the Hawkeye Board?
I can't explain. No.
Did the governor ask for names for potential people to volunteer for that capacity?
The governor office makes appointments for that board, so that would be a question that we would have to follow up with them. or you
Okay.
would have to follow up with them.
I think that would be helpful for the committee to know because the Hawkeye Board is composed of 7 members. 3 are the governor's department heads. The other 4 are supposed to be citizens. And we've had 1 slot that has remained open for over a year. The citizen died over a year ago. And the governor's office, instead of appointing someone, sent a letter to the Secretary of the Senate saying that they were going to defer on that position. I just really find it hard to believe that there aren't Iowans out there that wouldn't be willing to champion for our kids. My next question is for the MCOs. We have about 40,000 babies in Iowa every year, and I think a little over 18,000 of them, their moms rely on Medicaid. And I'd like to know how many maternal health care providers that you have in each of your MCOs and the distance Iowa women are having to travel to get to see a participating provider for pregnancy and prenatal care.
I don't think I can give you that statistic right off, and I'm very happy to provide that information as a follow-up if that can work.
We will follow up with the details specific so we don't miss any of those centers for you.
Same thing, we'll be happy to give you that information.
If I could add to that too, I'd also like to know how many birthing hospitals that you have and what locations that you have for those, and what level of care they provide. Thank you.
Thank you, Senator Petersen. Senator Dotzler.
Thank you, Madam Chairman. I guess I've got questions, but I'm not going to ask them. I just want to express my views. First of all, you're all very pleasant. When we ask you questions, I hear consistency of answers about how well things are going, and we'll work on this, and this is an isolated incident. And I know you're all very talented or you wouldn't be where you're at. But I think there's a serious disconnect from what we're hearing from you. And maybe you really believe what you're saying when we say there's no systemic issues, that these are isolated incidences. But the truth of the matter is, either you believe that and you're not seeing what's going on, or you're being influenced by your position to give us a consistent message. I've participated in a couple of these meetings out there in our area and listened to people, and most recently last week. We spent 2 hours with a whole broad cross-section of either providers in our area and patients. And we ran out of time and spent the rest of the time in the parking lot. They had to close the building. And I got to tell you, it is systemic. You have problems that are consistent across our district, everywhere, same kind of problem over and over. And I don't know how that's not systemic. You've got 3 billing processes that are completely different from each one. There's no consistency as a whole. And you've got providers who are trying to learn these billing systems, and they got to take their staff and learn 3 different paths in order to get paid. They're pulling people away from jobs that were providing services to people so they can learn your system. We hear over and over when people are trying to get answers, well, the screen tells us we can't do that. You've got call centers where people aren't connecting with you. They're not connecting with the stuff that we're hearing coming from you. You're saying it shouldn't operate one way, but the screen tells them it's got to be a different way. We had people break down and cry at that forum because medicines that they had been given were being denied. One woman who had major seizures had been working for years to try to find a medicine that she could work with, finally got something where she could be productive and go to work, and now that medicine is not available, and they want her to basically try everything again what she had tried before. I spent a lot of time with her in the parking lot after the event, and she was beside herself. Those seizures are major, and when she has one, people around her are in deep fear. These kind of things aren't isolated. They're happening over and over. Providers are telling us that they're working with patients, and now they're being denied the amount of type of services they're supposed to get in counseling, especially with people who have substance and drug abuse. You can only have so many hours. Well, that doesn't work with a person with a drug abuse. You need time to work through these processes. We've had people who can't get transportation. We had a candidate for mayor, their child, who's severely disabled, was dumped off by a cab on the corner and they couldn't find him. He had wandered around the community. So try to get that fixed. It happened 3 times in a row. 3 separate times. We've got a metropolitan organization up there with delivering bus service, and they deliver and take people to their appointments. No pay. The director over there, Mark Little, decided that he was so concerned on the patients that they picked up in the past that he continued to do it, knowing full well he probably wouldn't get paid. And their budget is in bad shape. They came to the legislature and begged for help to deal with people with disabilities who can't find transportation. So you got to jump on Uber. We don't even have Uber in Waterloo. So terrible cab service. That's not systemic. That's an isolated incident. Everybody in our town is living in fear. They're missing appointments. You know how long it takes to get an appointment? And when you do, and you miss it because you can't get transportation and that spot's empty, that doctor loses that revenue. Everybody else ends up paying for it. And these appointments are important because if you don't address healthcare issues when you can get in and you're waiting way too long in the first place, it gets worse and they get compounded. And I don't know how you save money. I'm telling you, I have a deep fear of what's going to happen when we walk out of this place. And we should continue these meetings nonstop all summer so we can work through these individual issues. Because if we just let you guys cut loose and do what you're going to do or what's being done right now and it isn't fixed, Iowans are going to continue to suffer. And I find that unacceptable and it tears me up. I walked out of that meeting and I felt like one of my best friends died. I got no power to do anything about it. My power sits here, yell and get worked up and try to get the message from people who are spokespeople who aren't paying attention to what's happening on the street level. You're not hearing what we're hearing. It's not all roses. It is systemic and it's across our districts from senator to senator. So please, I know you're caring people, but this can't be all about trying to find a way to save money by cutting services and not providing what's needed, because it ends up shifting somewhere else. An individual who has mental health issues around substance and drug abuse that doesn't get their treatment, we know what happens. We had a murder up in Waterloo area. Parkersburg coach was killed because that individual didn't get the kind of care that he needed. And that isn't even with a denial of therapies. It's going to end up more people in the courts, and we're going to be shifting the savings you make into some other place. This is some really serious stuff. People are deeply afraid with cancers, different types. I was supposed to get this covered, and I'd call them up and they'd say, well, no problem, that was a mistake on our part. And I started to notice that was happening more and more. And then I got thinking about it, so we wrote some articles in the local union paper. How many people are being denied for this? And it was systemic. They were denying people across the board, even though they knew they were supposed to pay it because they knew this one thing. Those individuals, some of them will go ahead and pay for it because they don't know how to work the system, and they didn't know they had the money coming. I'm not saying you're doing that, but I'm very concerned about it. So, Madam Chairman, we need to have some summer meetings. There are some problems out there that people are so afraid that they're never going to get help. And I know that if we can give these individuals the individual problem, they're going to work on it. But wrong. It's deep.
We can certainly meet, and we can meet in this room and meet this summer and fall. So we are kind of putting together the plans for that. This, this is such a big systems change, and this is a lot of money, and I think there's so much focus on this right now that we just have to continue to meet. We just have to do that. That's our duty and our responsibility. I have Senator Bolkcom and then Senator Jochum again.
Thank you, Madam Chair. Madam Chair, thank you for dedicating so much time, committee time, to this, and thank you, Senator Johnson, for your questions and your support to work on this in a bipartisan way. And I look forward to more meetings over the interim, because I think that's really our vehicle to do oversight, is to be able to ask questions. Senator Dotzler, thanks for your comments. I think you're right. We're all hearing kind of the same stories. Last Friday, I participated in 3 different listening posts in 3 different communities, and also had people break down and cry, and had people tell stories about their confusion about this transition, and heard a story from one of the transportation providers about how a cab was dispatched some 100 miles to do a ride in a small community that this regional transit provider would provide transit to. So there are some things to work out here. And sometimes I think that the folks that we've hired don't really have a very good sense of what's happening in Iowa. And maybe it's because we're getting call center advice from miles and miles away, where people really don't understand that it makes no sense to send a cab 100 miles to do a ride to the doctor. But apparently we've got some challenges in that regard. I'm interested in making sure we're tracking emergency room visits starting on April 1st to see what kind of emergency room utilization might be occurring as a result of this transition, where the people that we've kind of turned their lives on their heads, not only the consumers that depend on these health services, but their providers. But I think there are probably going to be some folks that are going to utilize services in an inappropriate way, and I'm interested in any data that we can track over the next few weeks and months about increases to our emergency rooms. I got an email I want to share just briefly from a case manager that happens to work for Johnson County, who recently did a visit with one of her clients and a case manager or care manager with United Healthcare, and she sends an email about that. So she had a meeting. United Healthcare case manager attended a recent meeting that I held with a client that is in high school, and we were discussing her transitioning out of her family home and into 24-hour SCL, into a 24-hour SCL home. I explained that the client was currently receiving hourly SCL services from a specific provider. The United Healthcare case manager then asked how the client got to and from the provider facilities for services, and she explained the members can only receive these services in a home, a guardian home, or a community setting. Therefore, the SCL would not be completed in a facility. So a little confusion about where and how services are paid for. After receiving a fourth quarter update on the client's progress goals, we started to identify areas in which the client could gain skill development that would help prepare her for when she makes her transition to living on her own, as completing her laundry, using the oven, finding volunteer opportunities, managing anxieties when not with their parents. The United case manager suggested the client have a goal to go and ride horses. We all fell into an awkward silence as it had nothing to do with what we were discussing. Finally, the United Health case manager turned to me and said, quote, "That's why you are here, because you know your client." After we identified new goals for the upcoming session that did not include riding horses, I was talking to the family about 24-hour SCL services and what those services look like. The United case manager then told the family they did not have to worry about the budget when she moved to this facility, as they would be managed by Verizon. I corrected her and stated politely that I thought she meant Veridian, not Verizon, the phone company, and the Veridian managed the budget of consumer choice options. Well, technically, and then she gets into who really does, and it didn't have any. So I spent at least a half hour in the meeting going through different types of waiver services and what they are. I also had to explain how funding worked overall. certain amounts of units were authorized. When I asked the United Healthcare case manager to enter in the client's new funding authorization for the upcoming year, she told me she did not have access to this. I explained that in a meeting they held the day before, the United Healthcare representative stated that the United Healthcare managers would be entering this information and that it was not something that we had, the current case manager, had access to. She then instructed me to send a generalized United Healthcare email address and that they should enter it. My client and family is going to need high level of guidance, information, and coordination as they transition to living on their own. After meeting with United Healthcare manager, I'm deeply concerned by her lack of overall knowledge concerning the ID waiver, its services, and providers. So, I mean, this is kind of sounds like our case manager in Johnson County is training the new case manager who seemed kind of not with it. And just kind of, and I don't know, I mean, maybe you're hiring people off the street and they don't really know what the system is. And it is a complicated system, all these waivers and units of service. And so it's concerning to this family, concerning to these case managers who, this particular case manager I know in Johnson County has been doing it for 20 years, really good at it. And now we're getting the rookie team on for United, because United apparently is hiring all new case managers. Can you tell me what training people have, and is the training on-the-job training where skilled career case managers are going to train your people? Because it sounds like that's what's happening in this example.
Well, thank you for the opportunity to comment, and I do want to say that we appreciate that feedback. And from a training perspective, our case managers do go through very specific training, and the goal is always to ensure that a member has a very well-trained case manager. We are going through that transition, and we do have managers that are doing oversight and ongoing review of the skill sets of our case managers to do that training. There has been, again, extensive training for those case managers, so we do want to hear that feedback when maybe a specific case manager has either not retained or not fully understood that training. That does provide us with opportunity in order to intervene and ensure that there's additional remedial training that is provided. Our goal is to ensure that we have a smooth transition. Our goal is to ensure that members get their needs met, that we understand all of those needs, and that we're wrapping those right services around the member. So it is good to have this feedback, and we do appreciate it, and we look to have that engagement so that we can address those members' specific needs.
Thank you. I appreciate that answer. I've got a half a dozen emails in the since Friday on this. This is one of them. And members are really busy. This is a really big issue, but we focus on all sorts of topics. And I could spend nearly quarter or half time on this. And I didn't I didn't forward that email to Paige. I don't know what to do with some of this stuff from either providers or consumers as we get this stuff. There's so much of it, and I don't really have much of an expectation about anything being able to be addressed about it. I would just end with this. I know that we continue to see Senator Jochum noted this rosy op-ed piece sent out by the Medicaid director, and the governor has his weekly press conference. I would hope that we could just end the rosy press releases and all this rosy talk, because it's really insulting to people. I got this vibe in the 3 meetings I was at. It was like, is the governor become so disconnected from the world? Because when you go to these listening posts and you hear just these story after story of people's frustration with what's going on, it's rather insulting to continue to see these rosy press releases that everything's going wonderfully, when we would all, I think if we would all kind of agree there are some bumps in the road here. And so that would be my request from the executive branch. Lighten up on the everything's wonderful press releases, because it is not selling out there. Thank you, Madam President, or Madam Chair.
Thank you, Senator Bolkcom. We have Senator Jochum and Senator Johnson, and we have about 7 minutes left. Thank you.
Thank you. So we're obviously not at the corner of happy and healthy yet when it comes to this. And you're right, I'm tired of the happy talk too, because it's not what we're hearing. I, as a mom of a kiddo with a disability, I can tell you, I am not convinced that any of the managed care companies understand yet to this day the complexities of the citizens of any state that has a disability. Whether it's SCL services, any of the waivers, I don't care. I'm not seeing proof yet that there's a true understanding of the real needs and how to fill those needs in a very timely way that's effective. I'll give you another month or two to prove me wrong. So, going back to Senator Petersen, she mentioned there's an opening at Hawkeye. Mickey, there is also 33 consumer openings on the MAC Council. And the reason I bring that up is because the House Republicans continue to think that somehow the MAC Council can provide oversight. There's 33 consumer openings on the MAC Council right now. If the governor needs help on filling those positions, all he has to do is let us know, and we will all gladly start submitting names of consumers of the Medicaid services to start filling those positions. They may have applicants, but there's 33 openings on the MAC board for consumers right now. On January 1, Hawkeye transitioned from the Blues to United. United stated they would honor the Blues pre-authorizations for speech therapy. United did not honor those pre-authorization, and claims were denied. Providers are still reporting that they still have January's claims unpaid by United Hawkeye, and when calling to follow up on claims are told that the claims center is far behind. Is the claims center caught up? Are January claims getting paid from Hawkeye?
Yes, January claims are getting paid, and so
I will get you the names of the providers who are not getting paid, and you can follow up with that.
Absolutely, we'd
All right.
appreciate that feedback.
Here's another one. This is in reference to out-of-network and in-network, because there were some who were led to believe that in the month of April that there was not going to be all this additional prior authorization requirements, et cetera. So here's one that says, this is an out-of-network therapy provider. AmeriGroup told us that if you are out-of-network, that you must get pre-authorization for PT, OT, ST visits on April 1. They told us the pre-auth requirements are waived for the month of April only for the in-network providers. Another example of where information given to providers from IME is different from what the trainings are. Anybody want to respond? AmeriGroup, then IME.
What I will say is that is not how we are administering it, so I'd love to follow up.
Okay, because it's happening.
Yeah, it is
It's
not-
happening.
it
And
is-
this is just not one
Yeah.
therapy provider, this is multiple.
yeah.
I'm getting the
Authorizations
same
are
thing
not
from
correct.
several, got duplicates coming left and right, all of them saying the same thing about that, the 1920 cap on therapies, that they don't understand the difference between rehabilitation services and therapy services when they're calling into all of your hotlines to get help and pre-authorization. Whoever is answering the phones do not know that there is a difference between rehabilitation and therapies. So that definitely needs to get straightened out, and the sooner the better, because I think all of us would like to start getting fewer phone calls, fewer people showing up at our doors crying, and fewer people sending us emails on a regular basis. Senator Johnson, go ahead. All yours,
Johnson.
buddy.
Well, I'm just going to make some comments, if I may, Madam Chair. I was late, and I apologize for being late, and I just want to make sure that you know that I'm not bothered by the meeting starting without me. I had to navigate an obstacle course to get to my seat, and I apologize to the electronic media, but I'm a print media person.
Yes, I know
And
you are.
in my life, so it probably some of that came out of me. But I just want to make the point, and I'm sorry, I was pretty hot when I came in here. And one reason is that I'm 18 years into this, in this legislature. Senator Dotzler, I admire your passion. I really do. We're going to have this happen, and I think it really does, it really is an extension of what the constituents who are contacting us are saying to us. I mean, we have a lot of experience in this room right now. We have a former county supervisor who worked a lot of mental health. We have a senator who had an MHI closed down almost unannounced in his area. We have a senator who lives this day by day as well as you two there. I'm not going to go on down the line here to all of this, but this is very, very important because a third example of what I had that hospital CEO forward to me is that a patient who was brought to our emergency department in an unresponsive state was denied an inpatient admission. The MCO agreed to a lower reimbursed observation stay. I want to know in the long run, and I'm not going to get that answer today, who's making medical decisions. That is, I can't imagine that my doctor can't say, I need to have an inpatient stay, and an MCO saying, well, we'll give you a lower reimbursed observation stay. Especially if I was unresponsive. I mean, we want answers to those items. We want real answers, and I just don't think we're getting them as to how these things happen. So thanks for letting me get that comment in there, and I certainly will agree that we need to continue this throughout the rest of the year.
Okay, thank you for all your comments. I just want to make one comment about the governors. At least they're consistent down in that communications office. You know, it's hard to keep up with those guys because it's just kind of a revolving door down there in the governor's office and communications. I think I've been here 5 years and they've had maybe 3 or 4 people. These success stories are written very well. I think probably written by somebody above the pay grade of the young man who's down there right now. But seriously, these success stories that were put out, really, this is, with all due respect to you, this is what you're paid to do. This is a contractual obligation. When you read through these stories, this is what you're paid to do with the taxpayer money that's been allotted and given to you. And so these are not success stories. This is performance. This is what you're paid to do, contractual obligations. So with that, Senator Bolkcom moves that we adjourn.